I'd like to introduce Dr. Jalal Khan to the Lifeability podcast. Dr. Jalal is a dentist, but really he's an alchemist. He's deeply passionate about spiritual alchemy and the alignment of the mind, body, and soul. Dr. Jalal is a firm believer that all chronic illness begins initially with an injury of the soul, and his life purpose is for you to find the healer within. Dr. Jalal states that he's not a healer, but rather you are your own healer, and he's merely someone that helps guide you in the directions that you feel are beneficial to your health and vitality. Dr. Jalal draws upon knowledge in dentistry, quantum biology, posture, breathing, osteopathy, fascia, emotions, functional neurology, and kinesiology to help his patients spiritually, physically, and emotionally align themselves, and he calls this process the dental alchemy. I hope you enjoy today's episode. Welcome, Dr. Jalal Khan, to the Lifeability podcast. Thank you so much for supporting my mission of reaching the wider audience and inviting them to explore and embody various strategies so that they can create a more meaningful life for themselves. I'd love for us to start off with you sharing a little bit about your journey into the dentistry world and the correlation that you've come across between dentistry and the quantum world.
Firstly, thank you for having me, Shraddha. It's an absolute pleasure and really excited about the journey that you're on to share this important information. The connection between dentistry and the quantum world, it's a little bit abstract, but essentially the mouth is a part of the body which goes without saying, but it's not really something that we're taught in dental school. And whilst we know the anatomy, we don't necessarily know what are the practical implications of the mouth being connected to the part of the body. So once you start to think of the body as like this whole system, that's an electrical being, that's a light being, and you start to think about fascia and you start to think about acupuncture meridians and things like that, and how the teeth lie on an acupuncture meridian, all of a sudden the mouth kind of starts to take on a different shape in my mind about the clues that it gives us around people's systemic health, meaning health in other parts of the body, in other systems. And it also gives us a clue about their posture, about their breathing, about their sleep quality, and a whole host of other things. So it's quite abstract in the way that I go about it, but maybe that's a good thing, and it's very exciting.
Yeah, it does sound very exciting. And, I had a little glimpse about your acupuncture model with the teeth and the jaw. And, having, I guess, known a little bit about how the meridians work in the rest of the body, I wasn't too familiar with the jaw itself. So that was quite refreshing to see. Um, would you say when, certain people have certain problems in their mouth, they then relate to different meridians? If we're looking at the five element system, for example, in traditional Chinese medicine, um, you know, have you found that they correlate?
Yeah, so there's instances sometimes where a tooth might be playing up in the mouth and it might be causing a pain or a sensation which is hard for the person to localize. It's irregular. It doesn't necessarily happen all the time, but that could potentially be relating to some sort of liver condition or some sort of thyroid flare up or whatever the case is. So usually there can be instances where the rest of the body is impacting what we see in the mouth and the electrical flow through the meridian that a tooth particularly lies on. On the flip side, we can have teeth which are diseased in whatever way, whether that be tooth decay, whether that be pulpal necrosis, which is the nerve dying inside the tooth, or some sort of infection around the tooth, and that could be having an effect on another system that's along that meridian. So it's kind of two ways. Usually the mouth can tell us a little bit about what's going on somewhere else in the body, or the mouth can actually have a negative impact on another part of the body. So I'm exploring, looking at getting what's called a bioresonance machine, which has an attachment which I can kind of place on each tooth to measure the electrical flow, to then gauge whether or not the tooth is reflecting some sort of systemic issue, or whether or not it is itself contributing to a systemic issue, which is an exciting prospect. But yeah, just working out if there's something that's out there. I'm talking with a couple of companies at the moment. It's pretty exciting.
Yeah, it does sound very exciting. Um, with your, I guess, prognosis, and when you're assessing someone, before you kind of perform any sort of dental work, do you find that you've had experiences where you've been able to work through the psychology of what the meridians is working on, and I guess prevent someone from actually having to extract a tooth, or has the decay become better all of a sudden when you've tapped into some of that psychology? Or yeah, just if you want to share a little bit about that.
Yeah, one of the measures that I use to kind of help nurse a situation that's kind of 50-50 and like teetering on the edge of heading south is I, I look towards homeopathy, because there's homeopaths that I work with or refer to. In fact, one of my nurses is actually training to be a homeopath, which is very cool, because it'll be amazing to have her in house. But homeopathy is quite a powerful modality to help with not only management of acute infections, etc., but also kind of keeping a tooth settled on a long-term basis. And I have patients who are holistically inclined who come in and tell me some of the successes that they've had with particular remedies or particular tinctures, etc. And it was them that got me really thinking about how homeopathy could really complement. Homeopathy also has an emotional component to it. So like some of the frequencies that these remedies have can also help to deal with underlying anxieties and stresses regarding dental traumas or any other sort of trauma. So I don't necessarily tackle the psychology directly like, say, a psychologist or a psychotherapist would. I've got to stay in my lane and know what my skills are and what my skills aren't. But I generally tend to lean towards homeopathy and get good results with that.
Yeah, and so when you refer them on to homeopathy, have you noticed that they don't have to go through a full process of the dental work and it's improved, or do they still need to have the extraction, or um, have you managed to, I guess, prevent an acute from becoming a chronic issue?
Yeah, yeah. Look, we get mixed success. Sometimes the situation is too far gone and it's not necessarily salvageable. So it may be that we take the nerve out of the tooth. We may not necessarily complete the root canal therapy. We'll leave the root canals hollow or filled with some sort of medicament, but we won't necessarily complete the root canal therapy. I hesitate towards jumping to extracting teeth just because teeth are critical from a postural standpoint, and the ligament around the teeth and the force vectors that the teeth send through the cranium and through the rest of the body when someone is biting and engaging them is quite profound and critical. So dental implants for me, whilst are a good replacement for missing teeth, are never as good a replacement for the actual thing itself. So I tend to be as conservative as possible when it comes to extracting teeth. But yeah, we get mixed results. Sometimes we win, sometimes we don't. But that's just the nature of medicine and biology.
Yeah, amazing. I want to tap a little bit into trauma, and it's commonly known that we store trauma either in our hips and our jaws. And I'm curious to know, for you and with the experience that you've had, have you noticed that when there's an underlying traumatic experience that someone's not, you know, I guess, dealt with, that kind of then it comes across as a physical issue in their jaw. And have you been then able to, I guess, provide them with certain exercises around that jaw work that has released some of that?
So I totally agree. Trauma is one of the big blockers for people to healing, and we do store it in the water inside of our bodies. Bone has a lot of water in it, or fluid in it. So obviously, so do our muscles, and most of our body is, well, 99% of the molecules in our body are water. So I would say definitely, like I've got a lot of patients that are storing kind of trauma or tension. Some of it is purely structural, so it could be they're using their jaw muscles to posture because the neck's not right, etc. So it's not necessarily an emotional or vibrational issue. It's purely a structural thing. But we have a lot of patients who using the jaws to deal with the emotional side of things. Like, if something's not working, what do we all do? We kind of clench our teeth and so what do I do? I use various mouth guards specific to the body type of somebody in order to kind of relieve things. And I work with osteopaths to help relieve those traumas as well, because we may not just have emotional traumas that we may store in our jaws and the associated muscles, but we can also have physical traumas that could date back to when we were born, or even how our arm and hands were when we were in utero in mum's womb. The delivery, whether was it a forceps delivery, was a vacuum needed, was the cord wrapped around the neck, was breathing difficult when baby was first born. All of these are considerations that they're questions that I ask my patients, because it gives me a clue as to kind of what was the initial trauma that may have set off their cranial and facial and dental development off on the wrong course. And what the osteopaths do is they don't just necessarily realign things, but they're also releasing trauma from different parts of the head and different parts of the jaw, with the manual therapy that they do. And that release of the trauma is kind of removes the blockage that allows people to heal.
Okay, and so I'm curious to know whether, if someone has had a traumatic experience, they don't necessarily have any dental issues, but they're looking at resolving their trauma from a holistic experience, and knowing that, we do store some of that um, traumatic experiences in our jaws. Are there any specific exercises, like for example, you have hip opening exercises to release some of that, if that is, commonly.
Yeah, look, I mean, there are kind of different types of massages that you can do to massage the jaw muscles, whether they be on the outside or even the inside of the mouth as well, which can help to relieve tension. And like, because sometimes the trauma and the grinding and the clenching can even lead to like a locked jaw, where it's like hard for someone to open their mouth as wide as what they normally would be able to. And so, like, if we release the muscles on the inside of the mouth, or I have patients that sometimes do it themselves, because it happens so often that they can't necessarily always just go and see a manual therapist every week to relieve it. So they learn how to relieve it themselves.
Yeah.
But doing so helps to unlock the jaw and allow there to be more opening. The the most interesting case that I have of like what you're talking about is a lady who grew up in Ireland, and she's she's got a very small upper jaw, and a very small lower jaw. And she grew up in a time in Ireland when, Ireland was split into North and South, and there was a lot of political turmoil happening at the time. And so she quite literally was not able to voice her opinion, or voice how she felt about things, just because it was such a touchy time. And I believe that that whole experience of growing up in that environment was embodied in the way that the physical form of her jaws took shape. And so in the process of starting to work with her, the first month was quite revealing for her. She, when we saw her a month later, she referred to it as like a, almost like she's died and been reborn again, because she kind of lived through all of these emotional this emotional turmoil, that she kind of relived it in the first month of treatment, wearing a mouth guard, having the manual therapy, etc., which was quite profound for me as a clinician to kind of see such an emotionally tumultuous period for a young girl show up in actually the way that the mouth developed. It restricted the development of the mouth. So we're kind of working towards. She's in her late 40s, early 50s from memory, and we're looking towards guiding the development of the jaws back to their optimal size. But first, we're kind of just dealing with the emotional side of things first, and so she's working with an energy healer and kind of clearing all that first. So yeah, I thought to share that particular case because I thought it would be something that you'll, given the nature of your questions, you'd find quite profound.
Yeah, I think that's it's quite interesting, like to understand that, but also be part of that healing journey and realize that you can release some of that with the work that you do. You mentioned using a mouth guard and massaging. Obviously, for a mouth guard, someone probably needs to go to a professional like yourself. But in terms of massaging, are there certain techniques that you can expand on that someone might be able to do themselves? Is there like a specific,
Yeah, look,
motion that they have to circulate on, or what are we targeting towards? Are we trying to go right to the back of the mouth, or are we going superficial? What's the go?
look, the ones that are inside the mouth are a bit hard to explain, because the location of the muscles, etc., is like, I wouldn't be able to talk and explain it. Plus, it's nuanced. But we've got this big muscle called the masseter, which is on the side of the jaws here. We've also got the temporalis, which is on the side of the temples. We've got the sternocleidomastoid muscle here. So these are like some of the three big muscles which can really get tight and tense. And so you're basically kind of doing a deeper massage, not kind of like a movement of the skin, but like a deeper massage, but you're going along the longitudinal axis of the fibers of the muscle. So if the masseters are going up and down like this, then you want to kind of be massaging down along those fibers. But yeah, look, the masseters, the temporalis muscles, the sternocleidomastoids inside the mouth. There's the medial and lateral pterygoid muscles, which are really prominent muscles that tense up for patients with TMJ issues, etc. But I mean, all of that is really, I will go as far as to say, still a band-aid approach to actually dealing with what's the root cause of the TMJ. And sometimes it's emotional, as you said, but a lot of the time as well, like, it's a cranial story, because TMJ is the jaw joint, but the T stands for the temporal bone, and the temporal bone is here, it's not here. And so the jaw literally hangs off the temporals on either side. So we as dentists must think less about the jaw as being the root cause of the TMJ issues, and more about the cranium as being the root cause of the temporal issues, which takes me back to what I was talking about earlier. What were the primary traumas that may have locked up one's cranium and resulted in the TMJ down the line? Was it the way that they were born? Was it a motor vehicle accident? Was it a sports injury? Was it a concussion? Because all of these things have a big role to play and are often neglected by dentists, not because of any more so just because they're just unaware of the importance of them. So it's really important that dentists start to think more bigger picture than just the mouth as being the root cause of the issues that they're seeing in the mouth. Usually in the body, when you see something that's wrong, that's just a sign or symptom, but the root cause is somewhere else in the body. What we see in the mouth is often just a compensation of what's going on further behind in the head, or further below from the hips or the feet even. So yeah.
And I guess you would be working closely with craniosacral therapists then in that referral
Yes,
zone.
I work closely with osteopaths. I work very closely with osteopaths. Every week I'm spending 1 to 2 days with osteopaths. All my osteopaths that I work with have got sound training and experience in the what's called osteopathy in the cranial field, which is kind of like the, the formal way of saying cranial osteopathy, where they're not only doing osteopathy but they're also understanding the cranial implications as well as the sacrum, which is the tailbone, and how the two are linked with the dura mater and how the mouth hangs off the front of that whole complex. So for them, they know that they're missing the mouth. For me, I know that I'm missing the cranial sacral. So for us to both work together is kind of just like a match made in heaven in terms
Yeah.
of the results that we get for patients. So it's thrilling to not just have kind of one osteopath that I work with, but actually three now. So the team is building, and we have another dentist joining soon who will hopefully be getting well versed in all of this as well. So it's all heading in the right direction.
Yeah, exciting. Um, in relation to people that require braces or have issues with sleep apnea, have you found that's predominantly physical structural work that needs to be worked on, or is there an emotional component there also from your experience?
So is this regarding braces or regarding sleep apnea?
Both.
Both. So look, I mean, braces is a physical representation of something further behind. So you have to kind of think of it as like as a projector projects onto a screen, the cranium, all of this projects itself onto the mouth. So what we see in the mouth is just a sign of what's further back. So when we see crowded teeth, it's because we've got. Well, if we see misaligned teeth, it's because we've got a misaligned cranium, which sounds like a crazy thing to say, but it's definitely the case because what different rotations and different positions that teeth take in the mouth are being driven by specific bones in the back of the head that are driving that. So there's definitely a strong correlation. Many dentists, if they were to listen to this, may question the validity of what I'm saying, but it would be kind of without them actually working alongside an osteopath and getting that biofeedback from like multiple osteopaths saying the same thing. It's kind of like they're commenting on something that they know nothing about. So with braces, it's structural. With sleep apnea, that's like multifaceted. It's not just a breathing thing. It's not just a small mouth, large tongue, or not enough space in the mouth for the tongue issue. There's a component to about like well the brain stem is the chemoreceptors in the brainstem are a key aspect to the drive to breathe. Is it a brainstem issue? Is it a brainstem compression? Is it excess artificial blue light? Is it a lack of sunlight? Is it a lack of grounding? Is it kind of like an electrosensitivity because they're so heavily bathed in non-native electromagnetic frequencies like Wi-Fi, like electrical devices that are plugged in? Are they wearing Bluetooth headphones or Apple AirPods? Like it's so multifactorial because it's not never just one thing that contributes to sleep apnea. It's fundamentally a multifaceted disease to do with structure, to do with emotions, to do with poor sleep hygiene, to do with mitochondrial dysfunction, and it's a big job to take on someone that wants to heal themselves of the sleep apnea, and it's kind of something which I have a frank conversation with them at the start that like you can't just do one thing and expect everything to go like to improve it. You've got to completely clean house in all aspects of your life if you want to get on top of this condition. And it's important that you do because the studies show that sleep apnea, if untreated, can take 10 years off your life for men at least, which is, that's profound.
Yeah. And it's, I guess, with any sort of chronic health issue that you have, right? Like you can't just work on one area. You have to be open to being multifaceted and, all these lifestyle factors that you're talking about, EMFs, blue light, grounding, all that does come into play with whatever's going on in the body and how it's being showing up.
Yeah, one of the things that I like to say commonly is that we've got this concept of topology. Okay, so topology was an area of science which won the Nobel Prize in 2016, Nobel Prize of Physics, which was for topology. Topology refers to like the size and shape of things, and what they were explaining was the fact that when things are exposed to different electromagnetic fields, the size and shape takes on it's a completely different size and shape. So if we actually look at what are the electromagnetic fields that are man-made, that is non-native, that we are exposing ourselves to now on planet Earth, it's actually, they've worked it out to be a billion times more non-native electromagnetic frequencies than we had even 100 years ago. So that's 10 with 18 zeros. That's
Yeah.
a lot of
Yeah.
excessive man-made electromagnetic frequencies. So what do we think that does to the topology of mankind? Mankind starts to take on a different size and shape, quite literally with obesity, but also at the cellular layer, at the quantum scale. Yeah, at the cellular layer, at the quantum scale, it's something which is often overlooked, but the light that we expose ourselves to, which is not just light that we can see, but light that we can't see, is probably the biggest impact on our health, ignoring the emotion side of things. I would still go far as to say that emotional blockers are probably the biggest blocker to health, and there's no amount of sunlight that's going to make you feel better about life unless you clear the emotions that may be associated with, a bad marriage or in-laws, or whatever it may be for somebody. But the emotional side of things is really important to clear. Even if you think of emotions, they're still light at the end of the day as well. And each emotion has a frequency and a color associated with it. So when we say light, we don't just mean light that we can see. We don't just mean light that we can't see, non-native electromagnetic frequencies, but we also mean emotions as well, because emotions are light.
Yeah, and even if we go back to the basics where, we might be able to clear some of those emotions, but if we have some really unhealthy lifestyle factors, then those emotions are going to keep coming up and we're just going to go through that vicious cycle. So it kind of works both ways. You have to do both at the same time.
100%. What I love about sunlight is that it actually helps your mind and your soul to just come back online if it's been kind of asleep for your whole life. Um, the sun makes helps us make something called beta endorphin, which is an opiate. Opiates make us feel good. That's why they're addictive. The most commonly known opiate is heroin. So if we are making our own opiate when we're in the sun, it means that we've been wired to be addicted to the sun, and that makes us feel good when we're in the sun. So it's kind of like a good fast tracking to starting to feel better. It doesn't mean it's a complete bypass. It's not a shortcut. You still have to do the emotional work, but it's a great way to kind of get things back online and get your head above water so that you can actually successfully carry out the emotional work.
Hmm. I want to ask you one more thing before we kind of wrap up. Um,
Sure.
with someone who's had to, have all their teeth out and I guess get into a soft diet, how is that going to impact their overall health when they can't, have those crunchy foods anymore and the TMJ is not getting the work that it needs?
This
And is
is a
there a
good
way
question. It's a
around
tricky
that?
one. Yeah, look, I mean, they need some sort of restoration to help restore the number of teeth in their mouth, but more importantly, they need something which restores their vertical dimension, which is how open their lower third of their face is when they are fully closed together. So a lot of people that are over closed, that have a lack of vertical in the lower third of the face, they're the ones that struggle posturally with like the neck issues and traps, and that obviously funnels its way down to the lower back and the sacrum, etc. So there's definitely like postural implications for getting the right restoration, whether that be implants, whether that be dentures. But the right restoration isn't just about something that looks nice, which is important, no doubt, but it's also something that works well from a chewing and mastication perspective. It is also because that's going to help restore a feeling of like, oh, I'm not restricted to just soft and chewy foods. I'm able to soft foods. I'm able to eat chewy foods like steaks or sausages, etc. Because people like to chew into things, whether they be nuts and fruits, etc. But the third implication is the postural side of things as well. So that's one which many dentists, myself included, for many years didn't really consider, but over the last 5 years it's become a lot more prominent in my mind, that if we get the mouth right, it really helps the rest of the body function optimally. And for an older person, that means better walking, it means less chance of falling, it means better stability, better balance, and that better locomotion is going to be better for their optimal health as well, because it helps them get outside and go for walks and get that sunlight, etc. So they're no longer just bedridden.
Yeah. So what I'm hearing you say is, because I have noticed people with disabilities or the elderly, once they have their teeth out, that's it. There isn't um, something else, I guess, to replicate that. But what I'm hearing you say is it's better to look at some sort of a restoration process, whether it's an implant or dentures, to actually not affect the rest of the body. Is that correct?
Yeah, so like I've said earlier, there's nothing like your own teeth, and obviously, pre- prevention is much easier than cure. Look after your teeth as well, regular visits to make sure that there's no issues. But if someone were to lose their teeth or lose several teeth, we have plenty of options to replace the teeth. They're removable options, they're fixed options. There may be multiple implants with with teeth joined together to sit on top of the implants. It could be dentures, which are removable. So there's definitely options. And going ahead with those is going to be really important from a quality of life perspective for that elderly person.
Yeah, so it's definitely better to have something than just let go and not have anything done to it.
100%.
Yeah, amazing. Well, thank you so much. I feel like there's a lot I could explore with you, but I am mindful of our time together. I'd love for us to finish off with three questions. The first one being,
Sure.
how would you like to see the future of holistic health and well-being?
I'd love to be a greater appreciation amongst allopathically trained clinicians like myself for the power of emotions and how that has a role to play in health outcomes. I'd love there to be more focus on returning to nature and keeping things simple, grounding, morning sunlight, UV light, safe and responsible sun exposure, rather than pivoting towards, okay, we're moving from pharmaceuticals, but we just pivot into supplements, which is kind of like a very similar replacement anyway, and not really regulated that much. Nature is the medicine, so seek that. And did you ask for three things,
Oh, I just asked for one, but you can
or
give
you
me
just
as
asked
many as you
you?
like.
And I'd really like dentists themselves to take responsibility to understand just how powerful the mouth is in healing, because that will help other clinicians in other aspects of health understand that, and that collaboration is going to be critical. Collaboration is a key value in the way that I operate, and I embody that with the clinicians that I work with. And I think we need to do a lot more collaboration rather than us just working in our own clinics, in our own silos, and not necessarily getting together and working on patients at the same time, because the results then are a lot more exponential.
Yep, I completely agree with you in relation to collaboration. Second question being, what is your favorite occupation? Occupation being any activity you like engaging in and why. I'm guessing it's going to be something related to nature, but throw it away.
Um, Honestly, for me, like just sitting on the beach, enjoying the sun and just thinking or meditating would be my favorite thing alone. I've got two beautiful young kids and a gorgeous wife, and they're in some ways beautiful to ground with as well. So they're very grounding for my heart and soul. So spending time with them as well is a really nice way to equilibrate after a big week.
Yeah, amazing. And the last one being, we know that oral health is really important for our general health and well-being. What are 3 strategies that you can recommend for everybody to incorporate in their life to, I guess, improve their oral health?
Get vitamin D. All right, increase your vitamin D levels, and that would be naturally using sunlight as opposed to with supplements, because there's a big difference between the two. The second would be maintaining optimal oral hygiene with the right toothpaste, like a hydroxyapatite based toothpaste, etc. Keeping good intraproximal hygiene in between your teeth as well. And the third would be eating a good diet as well, a good diet that's high in DHA, that's regeneratively grown and sourced organically, so that there's a good microbiome that's being fed into the mouth. Microbiome isn't just a food story, it's also a light story as well. So the better light that we get, the better natural sunlight that we get, the better our microbiome in our mouth and our gut is going to be. But vitamin D is a key pillar of dental health and whole body health. So that would be my number one.
Amazing. Thank you so much for sharing your wisdom with us. If people want to find out a little bit more about you, where is the best way to find you?
Look, thank you so much for having me, and it's been an absolute pleasure. I can be found on Instagram. My Instagram handle is K2Caliber, and I'm also writing a course on quantum biology, which is going to be shared by the Quantum Health Academy, and the Instagram handle for that is Quantum Health Academy. So looking forward to sharing that as well.
Oh wow, how exciting! Do you have a specific date that it's being released, or?
We're in the process of tying up loose ends regarding the writing of it, but we're going to be offering that in February next year, to my understanding. I'm writing that with a few colleagues, Kira Lee and Cameron Borg from Ricky Flow Nutrition podcast. But so all 3 of us are kind of working together to put this together. It's highly sought after. A lot of people want to know more about the quantum side of things, and we've kind of built this course, which is kind of like an A to Z, really walking people through, if they know nothing, to a level where they can kind of really help people. And I think it's foundational to any healthcare approach.
That's very exciting, and I think we really need a lot of that at the moment.
Thank you.
Awesome. Thank you. Well, thank you so much. That was really... Well, this is where your journey of exploration continues. Please subscribe to the Lifeability podcast so that you can stay tuned when new episodes come online. You can also follow us on Facebook and Instagram. The mission at Lifeability is to inspire you to create a more fulfilling life for yourself and improve your quality of life. So why not share this podcast with your loved ones and create a ripple effect together? Until next time, Asante Sana.